His health care reform is part of his legacy that he will be extraordinarily proud of. Joining me now, Congressman Gregory Meeks, Democrat from New York, who's spending a little of his holiday weekend with us. We appreciate that. Good to see you. So when the potential health care enrollees log on tomorrow, what you think's going to happen? Will there be messages? Will there be delays? Or it's going to be up and running the way it's supposed to be?
Well, I think it's going to be running. I think that more individuals will be able to sign up than before. All indications show that. I'm cautiously optimistic, but I would also urge individuals, because I know some, unfortunately, we're living in an age where people are praying for it to fail. We have a party for the first time that does not want success. So what we would urge folks to do is to go online, but go on off-peak areas, because we know that I'm told that 50,000 people at one time can get on, almost 800,000 a day. But we know some folks would love it to crash. They don't want it to be successful. So we're just telling people to go on, but go on off-peak times. And I think that you'll be able to sign up and get a good quality, affordable health care coverage.
And if there are the glitches, though, what does that say and what kind of problem will that present?
Look, we're going to work, and I hope that we get these glitches out. But when you look at the rollout, for example, of Medicare, there was glitches. And when you look at a number of other technological, when we deal with this new technology that we have, there's been glitches. But I think that from all reports, I know that the president has been one that's been focused on trying to make sure this is fixed. And from all reports that I'm receiving, it's not going to be perfect. The system is not going to be perfect, but up to 50,000 people at a peak time without any shortcomings, and even then individuals will be told to come back on. You know, it's happened before. I get on some kind of animated messages previously where it says, hold on, you're number 25 in line, and we'll get back to you automatically. So that should be in place also, but I think that it should be vastly improved.
But for those small business owners who are looking to try to get online, this thing's been pushed back a year for them. I mean, how much does that just send a negative message that really the Obama administration can't afford right now relative to this?
I think that the message is we're trying to get it right. See, what people are not focused on is that the product is a good product. In the long run, that individuals who were going bankrupt because they didn't have health care would no longer go bankrupt. You know, when you compare what's going on and what was the old system, you know, people now, you know, you hear some of my colleagues talking about just end the Affordable Care Act, which have no plan of their own, wants to go back to the old way that we were doing business with reference to health care. And when I think about that, when I think about all the individuals who were denied health coverage because of various reasons, specifically if you had a young child that was off your insurance plan under 26, pre-existing disease, we're away from that. And if you look at the overall cost of health care, its trajectory is down, which will save the government a whole lot of money so that we can create jobs and do other things that we need to do and get the budget in better order. And then refocus on this budget issue. The whole idea is to make sure that we are able to put 30 million individuals who did not have health care, give them health care. I think we're moving in the right direction. And I think there's already been a huge benefit to the Affordable Care Act that we don't want to go. We don't want to leave and go back.
Okay, well, we'll see what happens with it. It's just about 16 hours or so. We'll see at midnight what happens. Let's talk more about the fight over income inequality, because bringing the point home, as you know, yesterday there were protests outside of some 1,500 Walmart stores. These are workers that are just demanding higher wages. The company released this statement, sir, saying Walmart provides wages on the higher end of the retail average, with full-time and part-time associates making on average close to $12 an hour. We are also proud of the benefits that we offer. But do you think that the clash between the working class and the executives is reaching a boiling point here?
Well, when you look at what has taken place in America, clearly there's income equality, and it's getting wider and wider. In fact, if you look at the top 400, the richest 400 people in America, they make more than 150 million of the lowest. So that's got to change. And we've got to look at, clearly we've got to raise minimum wages. I think that we've got to do immigration reform. But most importantly, I know, and what was most substantial in my life was giving individuals a quality education, so that we can be more competitive, we can create better jobs, and they can take the better jobs, and then they'll have a higher income. Those are the things that we need to do, I think, and we can start ending the inequality, or start narrowing that gap again. But clearly, where we're going, where you look at the lower income individuals from 1999 to now, they've increased only 3%. But if you look at the increased wages of the richest of Americans, they've increased over 20-fold. So we've got to fix that. And I think one of the ways that we do that is making sure that our folks educated, we get immigration reform done, and quality health care to stop those who can't afford health care coverage from going further into bankruptcy.
Yeah, it's all kind of a synergy, all to work together there. It's Thanksgiving, so let's talk about the food stamps, because as you are well aware, a lot of these food banks and people who depend on food stamps, they've had it cut dramatically. And we know that the House Republicans plan over the next 10 years to cut some more $40 billion from the food stamp program. I mean, Democrats are saying, look, we'll agree to a $4 billion cut, but there's a huge discrepancy. How do you think this is going to play out?
Look, there's no way that we can allow, and nor do I believe that the president would allow, that kind of draconian cut that the Republicans are proposing. SNAP is not that expensive in the long run. When you look at how it helps keeps people, especially children, out of poverty, it puts food in their bellies. We are supposed to be the richest country in the world, and yet we're going to balance the budget on the poorest Americans. We've got to stop this reverse Robin Hood syndrome where we have gone with the Republican leadership and make sure that we take care of and help lift some of those individuals out of poverty. Just what we were talking about earlier. You can't expect a child to get an education if they can't get any food. SNAP is what will put food in a child's belly so they can get educated, and therefore they can then get out of poverty and be competitive in this globalized world that we live in today. So, to me, it makes common sense just to do that. And the Republicans are going in a different direction.
And like we say, it all works together.
It does.
We can't do one without the other. And we can't do without you. We're so glad you came to visit us, Representative Gregory Meeks. Thank you.
Good to be with you this morning.